It's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In the last blog, I shared what would happen if long-term ventilated adults and children in intensive care and their families would design home care. You can check out last week's episode by clicking on the link below this video. In this week's blog, I want to answer a question from one of our readers of our blog, and the question this week is: my 73-year-old mum had a stroke and is intubated in intensive care. She can't come off the ventilator and the breathing tube. Can she have a tracheostomy and go home and have intensive care at home? So one of our readers, Steve, writes, "Hi Patrick, my otherwise very healthy 73-year-old mother had a stroke around 2 weeks ago. She's still in ICU in one of the big public hospitals in Melbourne as she needs ventilation with pressure support and the breathing tube to help her breathe. The intensive care doctors haven't given her much hope unless her breathing on her own improves. I am wondering if your service, Intensive Care at Home, can be an option for her. Just some more details, and to shed more light on her current situation, her carbon dioxide levels were getting high and her pressure support was down to 7, so they've put it back up to 8. The carbon dioxide levels at the moment are fluctuating between 57 to 67 millimeter per mercury. She's already off all sedation and is getting more and more awake, and she seems to be out of the induced coma by now. She's responding, and she has made it very clear that she wants to fight and that she wants to live. I was hoping to get the ICU to do a tracheostomy and then get her home with your service, Intensive Care at Home, if she can't get off the ventilator soon. At this stage, the doctors in the ICU were quite adamant that tracheostomy is not an option for her, since the amount she's breathing at the moment isn't enough to sustain life, and they seem to have the opinion that most of the swelling in the brain would have gone down by now. Anyway, I was adamant with them about giving her time, and they agreed with that for now, and are relaying my thoughts to the main ICU consultant on duty later this week. They are saying her breathing levels, the amount she's taking in, isn't high enough to sustain life. For example, she's taking in 200 mils per breath, and she needs to be at 400 mils per breath she's taking at a bare minimum. Also, they are saying no nursing home will take someone with a ventilator, and I raised tracheostomy and ventilation at home as an option. They said it'd be highly involved with 24-hour care needed, pretty much. Can you please let me know what our options are? Many thanks." From Steve. So here is my response. Hi Steve, thank you for your question and inquiry. Well, we can definitely help you with intensive care at home for your mother should she have a tracheostomy down the line and can't come off the ventilator. Even if your mother needs ventilation with a mask, also known as BiPAP or non-invasive ventilation or CPAP, if she needs that down the line in a home care environment, we can help you with that too. Our specialty is to provide up to 24-hour intensive home care nursing once your mother is medically stable and off inotropes or vasopressors. It doesn't sound to me like she is on any inotropes or vasopressors. Therefore, once your mother has a tracheostomy, she should be able to go back home with our service, Intensive Care at Home. It's good to hear that you are standing your ground, and it's good to hear that you are asking all the right questions and that your mother, and that you're asking for what you want for your mother. Most families in intensive care are too timid to do that. They're often too scared and intimidated by the intensive care team's perceived power and perceived authority. 99% of families in intensive care are too timid to ask for what they want, and they therefore make no informed decisions. They have no peace of mind, no control, no power, and no influence. The good news is that even if your mother can't breathe by herself without the breathing tube, she can have a tracheostomy. If they don't want to do a tracheostomy and your mother has private health cover, you may also want to consider to get her into a private intensive care and get the tracheostomy done there. Given that she now has been ventilated for over 2 weeks, it's time to do a tracheostomy. There is a lot of evidence around this, when and why a tracheostomy should be done, and I inserted some links to articles in the written version of this blog below this video, when and why a tracheostomy should be done. For example, how long should a patient be on a ventilator before having a tracheostomy? Or how long can a breathing tube or an endotracheal tube stay in? Or what are the risks and benefits of a tracheostomy? Not doing a tracheostomy after about 2 weeks is not best practice, especially since your mother is awake, can follow commands, and is able to communicate what she wants and when asked. As you also would have seen by now, Steve, a breathing tube whilst being awake is very uncomfortable, and it isn't really best practice, as you can see in the articles and videos that are linked towards. Once she has a tracheostomy and she's medically stable, we can take her home with our intensive care at home service. And this again creates a win-win situation for all stakeholders, because we can give you, your family and your mother what you want, and we can reduce the cost of an intensive care bed by around 50%. We therefore also help the intensive care unit to save 50% of the cost and free up one of their precious, expensive and in-demand intensive care beds. Also, you mentioned her tidal volumes are around 200 mils per breath instead of 400 mils per breath. Of course, her CO2 or carbon dioxide levels are high. Increasing pressure support might help, and if it doesn't help, they will have to put her back into a different ventilation mode, such as SIMV, where she gets more help and assistance from the ventilator with set breaths per minute. You see, Steve, from my perspective, not giving your mother the option to have a tracheostomy could potentially kill your mother, and that to me is negligent as far as I'm concerned, especially since you, your family as well as your mother have made your wishes very clear. Furthermore, as you may well know, many patients can live at home with a ventilator and tracheostomy, especially with a service like ours, intensive care at home. Therefore, why deny this service to your mother? The intensive care team is correct to say that no nursing home will take her, and why would you or your mother choose to go to a nursing home anyway, if intensive home care is a viable and also more cost-effective option compared to an intensive care bed? The good news is that you and your family are positive, and staying focused and staying positive helps tremendously in a situation like this. If they had your mother's best interest at heart, they would do a tracheostomy, because a tracheostomy would make her more comfortable and it would give her time to recover, and it will be easier to wean her off the ventilator. Instead, they are telling you, quote unquote, your mother won't improve, without looking at what your mother's life may look like in 2 months, 6 months, or even 2 years' time. Of course, there are no guarantees, but throwing in the towel now doesn't sound right to me, and once again, not offering a tracheostomy because they think she's not getting better just simply doesn't sound right to me without trying and without giving her more time. Your mother is just at the start of what may potentially be a long recovery. There are no guarantees, of course, but they need to try, and they haven't really tried yet before they've given her a tracheostomy. You are doing pretty well positioning your mother's diagnosis, prognosis, as well as her care and her treatment, and I can see you are not scared, timid or intimidated, which will help you. Therefore, well done. So, if you want to find out how we can help you to get your loved one out of intensive care, including palliative care or long-term acute care, also nursing home, or if you find that you have insufficient support for your loved one at home on a ventilator, or if you have any questions, please send me an email to patrick@intensivecareathome.com or call on one of the numbers on the top of the website. Also, check out our career section. We are currently hiring ICU and pediatric ICU nurses for clients in Melbourne, Sunbury and in South Gippsland, all in Victoria. We are also an NDIS TAC and DVA approved community service provider in Australia. We have also been part of the Royal Melbourne Health Accelerator program earlier this year. Thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll see you again next week in another update.